setting the scene. I'm now delighted to introduce Ollie Hart, who is a clinical director of one of the PCNs here in Sheffield. He's also got some 20 years as a GP partner. I happen to be married to him. Ollie.
Can I have the microphone? So she won't let me get the microphone. and she's turned it off as well. She's always trying to shut me up. Oh, it's so cool to be here in the room with you. It's fantastic. And to see the show of hands, well, I think probably thinking about the people in the room and the teams you represent, we've maybe got 20-30% of the health coach team of the country here. So it's never been more exciting to be involved in health coaching. I've been a GP for 20 years and practicing in a health coaching style. And myself and Tim decided midway through last year that actually this is too important not to wholeheartedly get involved with. So we came out of GP practice to get involved. I still work as a GP in the city, and I'm still a clinical director of one of our primary care networks, because I think that context is really interesting. So I do understand this kind of slightly messy mission we're on, defining what a health coach does, what a care coordinator does, what a link worker does. We are sort of building the plane as it's flying, but that's forever the way with the NHS, isn't it? And it's what makes us so beautiful. But underneath it all, I know there's this spirit of really wanting to do the best by people. So thank you very much for everything you do. So I'm going to just talk about two things. Maybe a little bit about how I think things fit together in these new roles. And then I'm going to talk to you a little about our network. Just give you some ideas, just seed some things, just quarter of an hour. And then we're going to hear from Vandana, a health coach from the field. We're going to answer questions together at the end, if that's okay. So what's there to gain? Really, at the moment, there's never been a more important time to kind of feel like you're enjoying what you do. We're really lucky. We've got Professor Michael West, who lives in our city here, and he's a very eminent researcher. And he says the one thing that predicts quality in any service is how much the staff feel they're enjoying their work, how it feels meaningful and manageable. So it's really important we keep that sort of held up there. You know, what matters to you for your patients, but what matters to you for you as a staff member. And, you know, we want to feel like we're pulling together, don't we? You know, us with our patients, us with our teams, you know, coaches together with the medical team, you know, medical, social, you know, we want to be pulling together as a team. And if that happens, we get a great system, don't we? It's not just about the mechanics. You know, spoiler alert, I don't think ChatGPT is going to take over everything that we do. You know, we're humans, aren't we? We need human interactions. These tools can support us, but essentially we're human beings, aren't we, working together? And we know we need to be able to feel that we're doing something where there's a success, isn't there? So these are the things to gain. I like to just sort of think about the three areas that are going on from the perspective I have. And this is not, you know, this is just my view, really. But I think we're trying to align three worlds here. You know, so there is the traditional primary care team. You know, myself, Lanthi, Ian, you know, Tim, we've all worked in primary care. You know, and it's really essential. You know, we do things like diagnose things, but increasingly we rule out things that aren't there. We prescribe medicines, but increasingly we're starting to de-prescribe safely, saying actually, you know, the things you can do for yourself are probably more important than the medicines we can prescribe, and let's get you off those painkillers and those diabetes meds as you start to get better looking after yourself. And we can advocate for person-centered care, the role that people can take. And of course, you know, we pick up the things that are urgent. You know, we pick up the cancers and the kind of really urgent stuff that can be life-threatening, but it's a small part compared with the bit that people do themselves. So then you've got the coaching team, haven't you? You know, you guys are a really important part. You know, you build rapport and trust and connection, and you help people to think well and then to behave well. You know, with all the benefits that Amy's talked about. And in between the primary care team, you know, we've got, you know, the ability to do really good care plans and supported self-management. And then we've got the social prescribing team and with the link worker team. You know, and in their communities, they're doing asset-based community development. Mick's going to talk a little bit later on, you know, about the importance of building community. And, you know, and they're kind of like, they know what's going on. They can kind of track it and build it. And the interface of the primary care is around assessing those social needs, those wider determinants of health, and mapping people together and drawing them in a way they feel safe. And the overlap, I think, between the link workers and the health coaches are doing this together in teams, isn't it? You know, in groups. I know a lot of you are doing group working. You know, there's this kind of, there's real power, isn't there, in people together supporting each other as peers. So we need to make the most of that. And right in the middle, I know we've got some care coordinators in the room, there's this kind of like incredibly important job of pulling it all together, isn't there? You know, using the medical stuff, using the stuff that's in the community, but also then the coaching approach as well. No matter what stage of life you're at, even if you're end of life, you want to be in control and be, you know, making your own decisions. We want that 50% up to 100%, really, don't we? And those, you know, the link worker team integrates a whole lot of other sort of agencies around there, don't they? You know, this is really important, isn't it? They know the kind of almost the intangibles that are going out there. I know you guys will know them as well, but working with your link worker colleagues, you kind of this dream team, isn't it? And maybe, you know, then you've got the traditional community teams that sit over perhaps here. And, you know, increasingly in our primary care network, we're setting up these kind of like teams within networks that, again, overlap all these areas. So we might be working with a community mental health team that, you know, works really closely with us as health coaches and link workers and care coordinators. So I guess the issue I've got really is around this kind of like difference between sort of medicalised care and personalised care. And part of the problem I would reflect, and it'd be really interesting to hear what other colleagues will think, is that, you know, we have specialist medical teams in the hospitals and consultants, really important. But our relationship has tended to be a referral one. We've tended to pass people through. And in a way, that's led to us sort of getting sucked into it. Sometimes people here talk about the hospital being the mothership, and it kind of almost sucks us into this really medicalised model. And I think the game for us is to reclaim the middle ground that sits between real life people and communities. You know, for all of us, we're all real life people and communities, and what's happening in the medical specialised profession. We want both. And I think these three roles really help to draw us back to that middle ground and reclaim that really important place that, you know, primary care community teams can celebrate. So maybe the specialised teams sort of join us. You know, there's things they're going to do themselves, but they wrap in with us, and we show them how coaching approaches can be really important in secondary care as well. And let's not forget the role that patients play themselves. You know, the patients, I've put it in there, overlapping with community groups. But interestingly, one of our patient champions, a lady I've worked a lot with, and maybe I think this is what we call an integrated neighbourhood team. And that's, the language keeps changing in the NHS, but this is what all the language is talking about. Can we create integrated neighbourhood teams? And maybe across the day we can discuss how we feel about this. You know, I'm just seeding some ideas. And I was going to say, so to call to Elaine, who is one of a growing group of patient champions now, who work in our area, and she said, well, actually, patient, and don't forget Ollie, unpaid carers as well, sort of sit almost like a kind of an overarching thing across the whole top of this, you know, taking more and more of a lead. And I know that's what you do as health coaches really well, is you help people to sort of take a lead for themselves and get involved. So if I'm just going to shift, doing all right for time. We're doing all right for time, actually. This is good. So I'm a clinical director, which means I suppose I'm one of the leaders of a network, and it's growing. You know, I've been there 4 years. When we started, we had 2 staff, one social prescribing link worker and a pharmacist. We've now got 25, which is cool, isn't it? Amazing, with a budget of nearly £1 million for our staff. We've got 3 care coordinators, we've got 2 health coaches, we've got 7 link workers. You know, we're an amazing growing team. Funnily enough, because I coach health coaches, I've sort of like held back from, you know, it's like you don't bring your family in, do you? You know, I sort of like, I better not have too many health coaches, otherwise people will get upset with me. But I'd love to have 10 health coaches, I'm just not allowed yet. But we've sort of set our 2 key missions as a network, and these are like our meta missions. We've said, let's increase participation in however we can, because we know when people join in, cool stuff happens. And that's on sort of 3 levels, you know, what people can do for themselves, you know, what you will do, coach people to look after themselves well. What people will do together, so peer support, people will support each other. And that's hugely powerful, as I'll show you in a second. And then what they can do to contribute to the system. You know, what does healthcare look like when the group of, we've got 42,000 patients in our network. I keep saying, what happens when we've got 10% of them wanting to really contribute? 4,000 people who want to take part in what we're doing. And this bit here about meaningful and manageable work, I think it's really important. We just hold that as a key thing. So I'm just going to show you some examples. So I really like the writings of Suzanne Elaine. Has anyone come across her at all? She's a lady who's struggled through a lot of difficulties in her life. She's had to overcome a lot. She's writing for a really important think tank called Demos UK. And she's done research around power and control. And what comes out really strongly from her research is it's just such an important determinant of how well we all do. And you may know this yourself. So this quote I put up here, sort of, high power permits you to move forward in whatever you're doing. Low power subjects you to the daily perpetual frustrations of moving nowhere despite your best efforts. And that's what's really interesting, isn't it? If you're held down, if you don't have control, no matter how hard you try, and believe me, you'll know people are trying really hard, you don't get on to do the things you want to do. And I think that's what we do as health coaches individually. We help people to regain power and control. It's really important. So group work. I love this photo, recently taken. So we sort of took a bit of a punt recently in the network, and we sort of said, well, let's set up some patient-led groups. We'll look at diabetes. They said we don't really want a diabetes group. We want a sort of a group for people that have got diabetes that want to kind of get a better life, that kind of want to take control again. And they led it. So interestingly, that's Elaine at the back there. That's Frank. Those two organise it. Steve, again, is a patient champion, working with one of our community link workers here, Disha. And this was the first group. There's a couple more here actually want to be in, but we got people going together, and we didn't know what was going to happen. We just got it going, and it's been brilliant. They've run 3 cohorts now, and towards the end of it, they sort of said, actually, we think we're ready for a bit more knowledge now, Ollie. Would you set up a kind of much more sort of like reversing? We've heard you can reverse diabetes if you get really into it. So they asked us for that, so we've sort of set that up. But I love that dynamic, that they're in control, and it just seemed to be working really, really well. And they want to set up their own cafe, and it's just going where it's going to go. And in co-production, so interestingly, behind this there is a diabetes co-production group, and it's really interesting. This group of people here, some of them you'll recognise, Elaine there again, and Steve and Frank. The others, amongst them is those, and I'll challenge you to work out who's who. It's really interesting. Who's the nurse there? Who's the manager? Who are the care coordinators? You can't really tell because it's a level hierarchy and everybody's working together with the same mission of how can we help our local population to get involved and feel part of this. And we work really closely with our local community anchor organisation. So the PCN's been going for 4 years. Heeley Trust has been going for 25 years. The chief exec here, Andy, has been the chief exec for 25 years. He was born in Heeley, he grew up there, he really cares about the place. And May, who works with him now, who's been there for over 5 years, will be joining us this afternoon. I'm not sure if he's in the room yet. I don't think so. I think she's got a meeting this morning, but she's going to be joining us in a panel discussion this afternoon. So talking a bit about how do we integrate, those sort of green and orange bubbles, how do we work together, building on the sort of, they've been there much longer than us. They know the local assets and they know how to engage local people. So if we're trying to participate and get people involved, we'll work with them. And they do things like this. So they develop sort of infrastructure. They've been developing safe spaces. They've got ideas about low traffic neighbourhoods, making the place lovely to live, green spaces, sort of easy to move around through sort of foot and bike. And they've, for 25 years, been thinking about local ownership, local people taking a role. And I think there's a really big part. I don't know what you think about drawing health coaches out of the community, out of the local community. I can see a few people nodding. And there's this kind of, health coaching is almost an employment route, isn't it? The best coaches, I think, are people who have lived experience of physical and mental health, and you can draw them in with some coaching skills. And then once they've got some coaching skills, maybe they can go into a professional role, and then maybe they can be part of this whole participation. So it's a lovely progression that we can build. This is one of the events they ran a couple of years ago. We call it social prescribing, but it's a lot more than social prescribing, isn't it? That's the name we give it, to make the doctors feel comfortable, because it's got the prescribing word in there, but it's a load more than that. Yeah, I know, I've touched a nerve there, haven't I? Yeah, everyone's going, yeah. And this is one of my most favourite pictures, and Joey was really happy for me to show this. So this is Joey from our community mental health team. So we've got various teams in our network now. And it was 1 year anniversary. She said, come on, we're all going out together. And she's the youngest member of the team. And she stood up. She said, I want to do a speech. And it wasn't too many pints, and I think it was only a second pint. She says, I want to do a speech. And she stood up and she said, this is the best job I've ever had. And it was just like, you know, it was one of those spine-tingly moments. I just thought, that's what it's all about. It's brilliant. And that team is really functional and works very closely with the health coaches and the link workers. And that's the sort of stuff that just makes me think, we can do this. We can really do this. And I really don't think there's ever been a more exciting time to be part of a kind of movement for health coaching and this whole concept of how do we help people take control, you know, be the ones with the power and build communities together. And we're sort of like, I don't know, I'm sort of crusade almost to sort of push this hashtag, you know, that we are all the NHS. You know, the job you do is to help people become contributors, to participate and join in. And, you know, that's, I think, what we're all about. So I will be quiet and let Vandana come up and talk a little bit about the work that she's doing from the field, if that's okay. And then the three of us will be here for questions at the end.